Nurses, good morning. I'm happy to see the smiles you wear on your faces. Keep it up. Yeah, you don't take it for granted. Yes? Thank you.
Today, as we gather to celebrate Nurses Week under the theme, Our Nurses, Our Future, the Economic Power of Care, I stand before you filled with pride and gratitude. As nurses, we are at the forefront of healthcare, embodying the human touch essential to medical care. Our dedication and commitment touch the lives of thousands, from city hospitals to quiet rural clinics. Our role in preventive care and community health initiatives significantly lowers the long-term healthcare costs and enhances the quality of life, thereby contributing to a healthier, more productive workforce. This in turn supports economic development by keeping more active and reducing the burden of Kenya's healthcare system. It is the hope we give to the ill, the comfort we provide to the suffering, and the dignity we ensure for the aging. Our hands, our knowledge, our hearts are our tools. These tools not only heal, they also build a stronger society. It is a time to celebrate our achievements with pride, address our challenges, and set forth a vision for the future of nursing in Kenya. We are economic drivers, we are innovators, and above all, we are caregivers. Let us continue to strive for excellence, advocate for our profession. Together, we can ensure that the future of healthcare in Kenya is bright, and that the role of nurses is recognized not only for the care we provide, but also for the substantial economic value we add to our nation.
May we dwell in unity, peace and liberty. Let it be found within our borders.
That is my profession with conscience and with dignity. I will maintain by all means in my power the honor and the noble traditions of my profession. The total health of my patients will be my first consideration. I will hold in confidence all personal matters coming to my knowledge. I will not permit considerations of religion.
Ladies and gentlemen, the future of healthcare is linked to the empowerment of nurses. Redefining the value of nursing. Nurses need to diversify to improve the economic power of engagement in business, political, academic, and other leadership in the society.
The same thing the doctor learns. You are not a doctor's assistant, you are a core value in the hospital, right?
Yes.
You are not an assistant, you are a team. When they say the medical team stands together.
Before I even go into my speech, I think it has been said that I'm a nurse, and I'm a very proud nurse. I should mention that I am the first ever nurse to be a CEO in the office. There was a politician who last year said that a nurse cannot be a CEO of a public hospital. But I did not even open my mouth to defend my position because the nurses in the country had taken up that matter and they have really defended it to their lives. And that issue died down. So my journey has begun about 24 years ago, became a registered nurse, and then went to the land of honey and milk. And the best profession there, because I lived there, the best profession to be in the US is to be a nurse. And they are highly respected. In fact, they keep doing some public participation and public opinion and surveys every other year or so. And for several years, up to date, nurses are the most trusted profession in the US. So whatever we've had the powerful comments from our own Irene Wahome, that is right in my heart. I've said in another nurses forum, leadership forum previously, that we really seriously need to look into the welfare of the nurses who are taking care of these patients, because they're with them almost 80% of the time. This year, our theme for Nurses Week is Our Nurses, Our Future, the economic power of care. This reflects not only the significance of our nurses in healthcare, but also the crucial role they play in our economic landscape. Investing in nursing education and training is investing in our future, because nurses are our future. By providing opportunities for nurses to enhance their skills and knowledge, we ensure a robust healthcare workforce. As the hospital management, we are very keen to support initiatives that promote continuing education, professional development, and leadership opportunities for nurses. During this Nurses Week, we recognize and appreciate the hard work, dedication, and resilience of our nursing staff, particularly for the last 56 days. We know what the nurses have been going through, and they have been there for our patients. We really appreciate the work they do every day. Allow me, in the same breath of commending our nurses for their unwavering dedication and hard work, equally urge each one of them to remain dedicated to this noble calling. We really, I hope we can do a public participation and see how our Kenyans are rating the professional nurses, and I hope it will surpass the one of the US. Happy Nurses Week to each and every one of you.
On behalf of Prof. Kavi Mwendwa and the entire board of directors, welcome back to KUTRRH. Thank you for making time to come and celebrate with our nurses. When we faced all the challenges, our nurses continue to support our patients. Thank you. Patients have always shared feedback of your excellence and compassionate care. Madam Tessie, the hospital continues to advance nurses training through our Training Institute of Specialized Nursing, where different programs have been mounted. Notably, we have a team of nurses currently in India receiving training on kidney transplants as a service that is highly demanded, but few professionals in this country. On behalf of the board, I wish to assure the nurses of our commitment to advance your training needs. And for those few remarks, I welcome Her Excellency, Tessie. Thank you, and God bless you.
It is an honor to join you today as we celebrate this auspicious week together and contemplate the profound theme of the year, Our Nurses, Our Future, the Economic Power of Care, which highlights the contribution of nurses in the health sector, the crucial role they play in shaping the future of the sector's system, and its trickling effect in the economy. Kenyan nurses enjoy a prestigious global reputation for their professionalism, drawing significant interest from medical facilities worldwide. The heightened demand has improved their income opportunities, consequently positively impacting our local economy. The President also announced the employment of 20,000 nurses and doctors by the year 2027. Kenya had signed a bilateral labor agreement with foreign nations to enable female unemployed graduate nurses to seek employment overseas, and this became effective in mid-January this year. Take advantage of the goodwill that has been presented to you by the government. With all these efforts being put in place, it leaves no doubt the government is committed in its support towards the growth of nurses and recognizes the invaluable role and contribution nurses play in our socio-economic well-being. Dear nurses, do not allow your dream of being a Florence Nightingale, the lady with a lamp, dissipate, for it is this dream that keeps you going, even when you face the biggest challenges in life relating to your profession. And again, I must commend you. Thank you very, very much for holding the fort when the doctors were not within the hospital grounds. As we conclude this year's International Nurses Week celebrations, let us do so with a renewed sense of purpose and determination. Your service, sacrifice, and unwavering belief in the transformative power of care is admired and appreciated. May the days ahead of you be fulfilled with goodness and joy as you complete your week-long celebrity engagements. Thank you, and may the good Lord bless you all.